Are you looking for a new chiropractor and not even sure where to start or how to pick the person to go to? Today I'm going to go over a few kinds of chiropractors, 5 different techniques, and how to put it all together and pick out the person for you. All of this coming from an actual chiropractor. Hello, my name is Dr. Rhonda Marshall. I'm a chiropractor at Vaughn Chiropractic in Waterford, Michigan. First, let's talk about the actual chiropractor, what you may be looking for and what you can expect. If you have never been to a chiropractor, you may not even know what you are looking for. Chiropractors, like any other profession, come in all different forms. We have auto and work injury chiropractors, pediatric chiropractors, family and wellness. We even have animal chiropractors. Family chiropractors see all ages and for many different reasons. In my practice, my youngest patient was hours old, to my oldest patient being 99 years old when she first started care. If you are looking to bring your baby in for torticollis, a work or personal injury chiropractor may not be the person that you're looking for, since they typically see people for auto or work-related injuries. My biggest recommendation when looking for a chiropractor's office, call the office. Ask them directly if they see what you're looking for. Let them know what you're coming in for. Ask them if that's something that they often see in their office and something that the doctor is comfortable with. If you're looking for an auto accident or work injury or personal injury claim, make sure they're comfortable and know the rules of the state and insurances and how to deal with them and whether or not they participate with that insurance. Please know that in most offices, we're trained to see it all. So they may see a variety of different areas. They may see pregnant women and sports football players from high school. For me personally, I love to see all ages, from itty bitty babies to a high school lacrosse player to their grandparents, all for many different reasons. If you're going for something that may need x-rays, make sure they have x-ray on site, or if they refer out to get x-rays, and you need to know that. Why would a chiropractor take x-rays? I tell my patients I take x-rays for many different reasons. One, I want to rule out any traumas or anything that I may need to refer you out for that is not within my scope of practice. I explained to a patient yesterday, me taking x-rays is like you going to a mechanic, telling him how your car sounds and feels, but not allowing him to pop the hood and look underneath. I can come up with a lot of educated guesses as to what is going on based on your symptoms and what you're telling me and how you may have hurt yourself. However, an x-ray allows me to see more of things that I can't feel or you may not even know are going on. Without an x-ray or without the mechanic looking under the hood, they can come up with many educated guesses and they can come up with different ways to treat you, but it may take a little bit longer because we don't have all the information. When you get to a chiropractor's office, a typical visit or first visit may be involving paperwork to go over your history so that the chiropractor has an idea of where to start. In our office, we go over your paperwork, do some orthopedic tests, ask you questions based on what you wrote on your paperwork, take an x-ray, go over it together, come up with a plan, and adjust you. Now let's talk about different ways you can be adjusted. We call that technique. In school, we learn a variety of different techniques. Whether you are new to chiropractic or an experienced chiropractic patient, you may not realize that all different chiropractors have different techniques and going somewhere new can involve something new. We learn different techniques in school, and then when we get into practice, we start to evolve and adapt our technique. I had a roommate at Palmer College of Chiropractic when I was about ready to graduate and he was just beginning. He asked me one day what technique I was going to use. I paused for a few seconds, thought to myself, and then answered, I'm going to use what works on that patient. You see, I believe chiropractic works for everybody. We just have to find out what technique works for you. What does that mean to the average person? Some patients actually come in afraid to be adjusted. They think it's going to hurt. Other patients come in and can't wait to hear the loudest pop they've ever heard in their lives. Some patients are terrified to hear the pop. So I can adjust my technique to make you more comfortable. Other times though, your x-rays help me determine what is best for you and how to adjust you. So even though you may not want to hear the pop, it may be the technique that I should use to help you get better faster. In our office, we have 2 chiropractors, myself and my mom. We went to the same school. We even had some of the same teachers. I had some teachers that were her classmates in school. We always tell our patients we adjust the same but differently. So let's talk about some of the common techniques you may see in a chiropractic office. One is the Thompson technique. The Thompson technique is a low force technique that involves a table with a drop piece. you will hear and feel the table moving more than you will hear and feel your bones moving. Another common low force adjustment technique is called activator. Activator is a small tool that a chiropractor holds, and it releases a small force into the bone, allowing the bone to move. You will not hear or feel your bones move, but hear and feel the activator. Gonset is another very popular technique. Gonset is one that you will hear and feel the bones move. So if you're worried about that, it's probably not the technique for you. Gonset technique is sitting in a chair and you will hear your neck pop, or laying on the table on your side to do your low back. Diversified is a fourth technique, also something you will more than likely hear. And then upper cervical, you can go to a chiropractor with low back pain and all they will look at is your upper neck. There are many other techniques and I could go on and on. Palmar package is a common term for the technique that I would use in my office. Palmar package is based on our school, Palmar College of Chiropractic, and in my office, I take a variety of all the mentioned adjustments above and I use all of them on different people. This goes back to my original statement. I do what works best for the patient. Now that you have an idea of what may happen and what happens in the chiropractic office, how do you actually find the person to go to? Everybody goes to the Google, but isn't Google kind of like the old yellow pages? And I may be dating myself here, but going to Google is like opening up the phone book, closing your eyes and pointing at something and calling and taking a chance. I give Google a lot of credit for adding reviews, and reviews can be helpful. But when you're going to a small office or a small area with a small office, we may not have a ton of reviews. In our practice, we have reviews and they're all good except for one who was never actually a patient or walked into the office. So I am leery now, even in my own personal endeavors reading reviews, on how seriously to take them or not. Where Google is a good resource for finding a chiropractor is location. There are chiropractors everywhere near me. So finding somebody an hour away may not be the best situation for you. So in my opinion, Google is a great starting place because you can find it based on location. Another great option is Facebook. Isn't Facebook the new Google? How many times a day do you see your friends posting, does anybody know so-and-so, or can give me a referral to this or that? I myself use Facebook for that kind of thing. However, I don't post it in community groups with a bunch of strangers. So in reality, when posting in Facebook, aren't we truly asking our friends who they go to and getting a direct referral from our friends? I think this is a great method. Your friends know you, or at least I hope they do. They know what you're looking for, they know who you like, they know what you like, and more than likely they've been to that chiropractor and can tell you what to expect. Lastly, if you're moving, if you're driving an hour to your chiropractor, don't be afraid to ask me. I have had patients move out of town and I have helped them find a chiropractor for themselves. I understand that getting to a chiropractor an hour away isn't always the most convenient. We do have patients, however, that even after they move, aren't willing to give us up. And they live a little bit further away and realize that our relationship that we have built and the trust and the care is worth the drive. Chiropractors are different. We are not a traditional white coat doctor. Personality goes a long way. I get it at my age. I'm not for everyone, and everyone is not for me. You may come to my office, and although I can adjust and I'm great at what I do, I love what I do, I may not be the person for you. That's okay. Find somebody that you click with. Talk to your chiropractor. Make sure your goals and the doctor's goals are the same. Make sure he or she understands your goals. Make sure he or she understands what you want out of the visit. Your care will require goals and expectations. Putting them out there in the beginning helps everybody get better results. Working together will always get you better results as well. As always, like, comment, subscribe, and share, and we will try to answer any of your comments.